Feeling a bit off after surgery, perhaps a little sluggish or uncomfortable in your belly. It is really common to experience some digestive changes as your body begins its recovery process. While occasional constipation after surgery is quite common, you should definitely call your doctor if you experience severe abdominal pain, persistent nausea, or vomiting that does not go away, a distended or bloated belly that feels very hard to the touch, or if you have not had a bowel movement for more than 3 to 5 days since your procedure. These particular symptoms are not just about temporary discomfort. They can truly indicate more serious underlying issues that requiring medical attention. Anesthesia from your surgery and the pain medications you might be taking, especially opioid-based ones, significantly slow down your entire digestive system. This slowdown can lead to a substantial buildup of stool that, if left unchecked, might cause a serious bowel obstruction or even an impaction. Furthermore, your body is actively healing after surgery, and any excessive straining or significant pressure on your abdomen could potentially interfere with your recovery process, which is especially critical if you had abdominal surgery. Understanding why these signs are serious helps you to avoid potential complications and supports a much smoother and safer healing journey. It is truly your body communicating something important that needs your attention. Before you immediately reach for the phone, you can often try some initial steps at home. Focus on gradually increasing your fluid intake, walking gently around your home if your doctor has approved light activity, and carefully incorporating fiber-rich foods into your diet if your medical team says it is okay. However, it is vital to remember that if those critical red flag symptoms, such as severe pain or prolonged absence of bowel movements, begin to appear, then you must not delay in contacting your healthcare provider. When you do call, be prepared to describe your symptoms very accurately. Tell them exactly when your symptoms started, how severe they are, and any other changes you have noticed in your digestion or overall well-being. Your doctor will rely on this detailed information to guide their advice or determine the most appropriate next steps for your care. It is also helpful to understand a key difference between commonly recommended options like stool softeners and stimulant laxatives, as they work in very different ways. Stool softeners, such as docusate sodium, primarily function by adding moisture to your stool, making it softer and much easier to pass. Stimulant laxatives, on the other hand, directly encourage your intestines to contract, actively pushing stool through. Your doctor will be able to advise which type, if any, is most appropriate and safe for your specific post-surgery recovery. Additionally, sometimes very gentle abdominal massage, if explicitly approved by your healthcare provider, can occasionally help to stimulate some gentle movement in your digestive tract. Being proactive and vigilant about monitoring your bowel movements, and most importantly, recognizing these specific warning signs, truly empowers you to take active control of your recovery. Early communication with your healthcare team helps prevent minor discomfort from escalating into a more significant setback, ultimately ensuring that your primary focus can remain on healing, regaining your strength, and feeling better as quickly and safely as possible.